Here is your question. There are a little bit more on the second page. So once you've done reading, please tell me, I'll change.
Okay, next.
Let's see.
Okay.
Right. So if
Next.
you've read, it's just that these two. If you've read and understood, considering it critical care scenario, please tell me what is the provisional diagnosis you'll consider after you've read the stem.
My top differential diagnosis is acute pancreatitis.
Very good. What are the differential diagnosis you'll consider?
Other differential diagnosis, it could be uh, acute cholecystitis.
Very good.
It could be gastroenteritis,
Yes.
or it could be pyelonephritis.
Yes.
It could be ectopic pregnancy.
Okay.
Also, it could be perforated
Viscous.
perforated viscous or perforated ulcer, peptic ulcer disease.
Yes, it can even be ascending cholangitis. All right. Please tell me what are the causes of acute pancreatitis?
The main causes of pancreatitis, it could be the gallbladder stone,
Yes.
or alcoholic, or viral infection, or
Very
some
good.
drugs.
Very good. What is the pathogenesis of
The
acute pancreatitis?
pathogenesis of pancreatitis, it could be gallbladder stone that dislodge in the ampulla of water,
Yes. And
and obstruction, then autolysis of the pancreas by pancreatic enzyme.
yes. Continue. Tell me the
Okay,
four percent.
and then infiltration of the pancreas with the acute inflammatory cell and damage of the parenchyma of the pancreas.
Okay. In order to stratify the risk factors for this patient, what
Yeah.
are the diagnosis systems or scoring systems you are aware of?
Glasgow score, Glasgow
No, no
score,
Glasgow, Ransom,
Ranson and
and
Balroth score by
very good.
CT scan.
Yes, and Apache 2.
Apache score.
Yes. Okay, what is Glasgow's criteria?
Glasgow criteria, it is referred to BA2, oxygen saturation, and A mean albumin, N neutrophil, C the calcium, R is the urea, and S is serum amylase.
And partial pressure of oxygen should be less than
Less than 6,
8 kPa.
8.
All right,
Okay.
okay. And neutrophils should be how much?
And neutrophil above 15,000.
Yes. And calcium should be more than?
Less than.
Less
Calcium
than.
less
Very
than
good.
2.
2, very good. Okay, now please tell me what are the causes of hypocalcemia in case of acute pancreatitis?
It is due to liquefaction of the mesentery
And
and what?
yes,
Liquefaction of the mesentery and deposition of the calcium in the mesentery.
okay, there is because of fat saponification and
Fat
which is
spherical.
released by the pancreatic enzymes, and
Yeah.
then uh, free fatty acids are chelated with calcium.
Yeah. Yeah.
Yes,
Yeah.
you
It's
have to tell me all
deposition.
this,
Okay.
which causes hypocalcemia, and there is deficiency of parathyroid. Pyrothyroid gland as well, destruction because of proteolytic enzymes. Okay, please tell me why this patient is having why this patient is tachypneic.
Because the patient is could be due to the pain, could
And
be
yes,
due to she is in sepsis, or could be irritation of the diaphragm,
okay,
or it could be lower lobe pneumonia, or could be BE, pulmonary embolism.
all right, okay. What they say, because of abdominal wall, there is overdrive or stimulation of sympathetic overdrive, which causes increased pressure in the abdomen, and that leads to
Tachypnea.
tachypnea.
Okay.
Yes,
Okay.
right. There are two situations in which, in case of acute pancreatitis, there are two situations when serum amylase turns out to be normal. Please
Yeah.
tell them.
After 48 hour,
Yes.
and it could
Too early,
be
when it is too early.
yeah, too early, or after resolution.
All right, okay. If you don't get to manage the patient on time, what are the complications that can occur?
It can be developed septic shock. It could lead to diabetes mellitus. It could be lead to a pseudocyst of the pancreas. Also, it could be uh, adult respiratory syndrome.
Yes.
Yeah, and indigestion of the protein and fatty meat.
How would you take care of the nutrition of patient in acute pancreatitis?
Nutrition. This patient need resuscitation of the with the IV fluid. Uh, non per oral NBO, and
Okay, please tell me, how would you manage the pain of this patient?
this patient could be according WHO pain
Pain ladder, yes,
pain ladder,
yes,
starting with paracetamol,
yes.
then non-steroidal also, then with a weak opioid, then with a strong opioid.
Okay, now what is the blood test that you'll do, and when the result will come out, you'll suspect patient has pseudocyst?
ESR, CRB,
Serum amylase.
serum, yes, okay.
Okay, please tell me if you or if you'll not give the antibiotic to the patient with acute pancreatitis.
Do you give?
Antibiotic to the patient?
Yes, I give for antibiotic for hair,
Yes,
because it looks
according to the trust guidelines.
yeah.
Okay, you can please tell me what are the enzymes which rises in case of acute pancreatitis?
Amylase and lipase.
Very good. And which one of them is more conclusive and more
Lipase.
significant? Lipase.
Lipase.
Okay. Why a patient with acute pancreatitis presents with hyperglycemia?
Because the destruction of beta cell of the pancreas Langerhans
Yes,
cells. Yeah.
very good.
Lead to deficient in the insulin secretion.
And
Uh,
there
and,
is stimulation of stress hormone, which releases
yeah. It releases
glycogenolysis.
glycogen,
Yes,
from the liver. Yes.
and causes glucogenesis. Good, very good. Okay, thank you.